Been waiting for more news on President Trump's condition after he was diagnosed with coronavirus. He was taken to Walter Reed Medical Center last Friday for treatment. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, what's your take on President Trump's condition and why do you think he needed to be hospitalized?
Well, I think at this point in time, we really don't have a very clear picture of just how sick he is. I think the only people who could give you that information are the people who are in direct contact and care of him. In other words, his healthcare providers at Walter Reed. I think that based on the information that we've gotten in terms of the fact that he had drops in his oxygen level, as well as the fact that he's received some pretty heavy duty treatments, including antibodies, as well as remdesivir, as well as steroids, you would have to come to the conclusion that he's very sick. However, that's not quite the message we have been getting. We have been told by the White House physician that the president is doing well. He is improving each day, but some of those briefings that we've received have been, from a medical aspect, incomplete, to say the least. And even the White House physician says that he is trying to project an upbeat sort of picture of how things are going. And therefore, I don't know just how much we can rely on the information that we've gotten so far. I think no matter what happens here, whether there's a discharge, no discharge, the one thing everybody needs to remember is that there's concern in the days ahead. A patient with COVID can be doing very, very well, seeming like they are on the road to recovery. But there is something that tends to happen about the 7 to 10 day mark into illness, where there's a reaction in the body and a patient suddenly and acutely deteriorates, especially from a breathing standpoint. And so he is far from being out of the woods at this point in time. And I think the week ahead is going to be very telling.
Yeah, certainly something we'll keep an eye on. You touched on this a little bit, but President Trump took dexamethasone for COVID-19. What is that drug and what could taking it mean about his condition?
Yeah, dexamethasone is a steroid, and steroids are recommended for the use in certain cases of COVID. A steroid works by decreasing swelling and inflammation. So when you think about someone who has a lot of lung involvement with COVID, you will hope to improve lung function by decreasing the swelling and inflammation that takes place. But the thing is that we usually only use dexamethasone later in the course of treatment, or someone who is on continuous oxygen or is on a ventilator. So you say, why give it at this point in time? I don't know, because we worry about the side effects and issues that dexamethasone can cause early in the course of COVID. We know that dexamethasone and other steroids actually decrease your immune system ability to fight COVID. So on the one hand, if you give it to a person who needs it, it's very effective. If you give it too early in the course of disease, you actually can make things worse.
That's very interesting. Switching gears to here in Colorado, coronavirus hospitalizations rose to 200 for the first time since August. Does this increase in cases surprise you, and should we be concerned about this spike?
I think it's definitely a concern, because when you look at what's going on around the country, we're seeing increases everywhere, with the exception of, I think it's 3 states. Everyone is seeing a bump in numbers. When you see a level of hospitalizations begin to rise and then consistently stay there, you do get concerned, because it's telling you that there's more activity, serious activity going on in the state. Now, some people will say, well, you know, we just reopened schools and university settings are responsible for the rise in case counts and the rise in positivity rate, but it really is that hospitalization rate that is a key thing to look at, because that tells you that it's getting out into the more vulnerable populations. It is spreading into the community. And so when we see this, even though it's not at the level we were seeing in the spring, it's a warning sign. This is a red flag that something is percolating in our state. And I think now more than ever, you need to be masking, you need to be social distancing, you need to be doing all the things we've talked about, because we don't have great treatments. We don't have vaccines that are going to be available for everybody at any time soon. We are in a situation where we worry that we are on the cusp of a cluster of cases here in Colorado that we really do not want to see. So please continue and improve on what you are doing to protect yourself and to protect others.
Yeah, certainly not a time to let your guard down. Well, we have also a new survey found 1 in 3 parents say they have no plans to get their kids the flu shot. So what's your message to those parents?
This is pretty much what we see in years past. The parents in general are pretty good about getting their kids flu vaccinations each year, and it's more important this year than any other year. But for those who don't immunize their children against flu, the concerns tend to be the fact that they worry about side effects from the flu vaccine, as well as the fact that, well, maybe the flu vaccine really isn't necessary, it doesn't work. Well, side effects really should not be a major concern when it comes to flu vaccine, either for children or for adults. The vaccine itself is a killed vaccine. In other words, you're not being given a live virus, and any side effects that you might have generally are very mild and actually indicate that your immune system is responding to the vaccination. So if you get a sore arm or feel a little bit achy, that actually is not a necessarily bad thing to experience. In terms of how effective a vaccine is, no vaccine is 100% effective. In fact, when we have COVID vaccine eventually show up, if we get 50% effectiveness, we're going to be happy with that. The same is the case with the flu vaccine. But the thing to remember too, even if it doesn't completely prevent you from catching flu, it will decrease the severity of the illness. And that is particularly important in children. Your kids are at risk for complications from flu if they are not immunized. More than 20,000 kids across the country were hospitalized last year because of complications of the flu. They get things like pneumonia, and they get things like swelling of the brain, as well as other side effects and complications from flu. And we don't like to have that happen. The biggest group that is most vulnerable is the age group under 5 years of age. And so it is really vitally important that you protect your child as well as yourself by getting a flu vaccine.
Yeah, very important information. Dr. Dave, thank you as always for joining us, and we'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.